all you beautiful people who are pregnant, planning to get pregnant, or have been pregnant in the past. Pregnancy is a beautiful journey for any couple. However, whenever there is bleeding during pregnancy, it can leave you anxious and baffled and lead to a lot of unrest. This is She the People TV, and I am Dr. Theertha Shetty, and I am going to talk to you about bleeding during pregnancy. Let me clarify a simple point. Bleeding during pregnancy does not always mean that you are headed for an abortion or a miscarriage. That brings me to my next question. What causes bleeding during pregnancy? In the earlier half of the pregnancy, bleeding could be because of the following. Wherever the baby gets implanted or wherever the baby gets stuck inside the uterus, that part of the uterine lining may get shed, which is called as implantation bleeding, and it often corresponds to your expected date of period, and that is normal. Next, if your pregnancy is not progressing normally, if there is a possibility that if the pregnancy progresses further, there may be an abnormality in the fetus, then it's nature's way of not allowing it to grow further, and you may have bleeding during an abortion or a miscarriage. And lastly, if the pregnancy is implanted outside the uterus, the most common site being the fallopian tube, also known as an ectopic pregnancy, then you may present with bleeding. In the latter half of the pregnancy, that is the 4th month onwards, if the placenta is implanted in the lower part of the uterus or close to the mouth of the uterus, that is the cervix, you may present with bleeding. If your doctor has done an internal examination when you're close to your expected date of delivery, you may have some amount of spotting. And lastly, if you are in early labor, you may pass something called as SHOW, which is the cervical mucus plug mixed with blood, which may present as spotting during pregnancy. Now, when you have bleeding during pregnancy, what should you do? Number 1, do not panic. It is not going to help anybody. Number 2, talk to your doctor and visit them if they advise you to do so. What will your doctor do? Your doctor will take a detailed history about the duration of the bleeding, the amount of bleeding, the color of bleeding, the number of sanitary napkins that you may have changed, if you've passed any clots. Next, they would do a clinical examination, like checking your pulse, your blood pressure. Then they would do a per abdominal examination if you complain of pain. And in the latter half of the pregnancy, they may check for the height of the uterus and see if you have any contractions, that is, if you are in labor. They would then do an internal examination. In the earlier part of the pregnancy, they would see if they can feel any clots or any products of conception inside your vagina, or if the mouth of the uterus or the cervix is open. They may even look for any signs of an ectopic pregnancy, that is, if the pregnancy is implanted in the fallopian tube. If you are in labor, then an internal examination would include checking for the cervical dilatation. In early pregnancy, if you are having bleeding, they may advise a blood test called as serum beta HCG, which is the pregnancy hormone. They may check for the levels of the same. They would do an ultrasound examination to see the location of the pregnancy, the duration of the pregnancy, to see the status of the cervix, and to see the location of the placenta. They would also see if there are any clots in the earlier half of your pregnancy, which could be the causative factor for your spotting or your bleeding. After the entire evaluation is over, the doctor will then advise you regarding the further plan of management. Next time you have spotting or bleeding, I hope you will remember whatever I have said until now and do accordingly and not panic. Stay safe, stay healthy.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.